It's Dr. Greg. As a counselor, mental health professional, founder at the center, I want to just spend a brief moment talking about how obsessive-compulsive disorder impacts relationships. And this is important, OCD. What is it? It's a mental health disorder involving intrusive, distressing thoughts, that's the obsessions, followed by the compulsive behavior, that's the acting out. Now, this can get severe. It can take a good portion of a person's day, and there are many different things that you can become obsessed with, and everything from something's not clean enough to trying to control something, checking and rechecking things. So OCD really is a mental recycling over and over and over. Now, it provides some initial relief, but then it creates more distress. Here's some things that can happen in a relationship. Constantly seeking reassurance. The person with OCD may repeatedly ask for validation that I'm okay in order to reduce the anxiety. There's also the fear of harm. I can even be afraid of hurting a loved one. But a lot of this becomes quite irrational, and it can cause me to withdraw in a relationship. All right, the next one, irritability, and I'm going to say fatigue. Just the mental load of OCD can cause a lot of just pure emotional exhaustion. And finally, there's guilt and shame that can be associated with this, where the OCD, they feel ashamed of the compulsions. They're afraid of judgment and rejection. So, all right, now here's some common dynamics. If it's, let's say, a romantic partner, they may feel overwhelmed by the rituals of this, and they can feel like the caregiver rather than an equal partner. Sometimes unintentionally, they become a part of the compulsions, checking things for the other person over and over and over. Family members, you might feel like you're always walking on eggshells. You might misunderstand OCD as it's a choice. They're like choosing to do this, so it gets quite frustrating. And I do know that friends and coworkers, what happens, there can be a lot of just isolation because it's too much to deal with. And the OCD rituals can interfere with work performance, working as a team. Now, here's what's so important. We've got to encourage treatment. OCD requires an appropriate treatment intervention by a professional or a team of professionals or a program that really understands getting to the core issues related to OCD, how to help. There are tools through both cognitive behavioral therapy. There's tools through DBT, dialectical behavioral therapy. So there's options that are available, and also just at times dealing with significant trauma in a person's life. It is the work we do here at the center, a place of hope, and we know just the heavy burden and the distress that OCD can cause.